Hi, this is Hita and this is my anatomy final project. Today I'll be going over hyper and hypothyroidism, deep vein thrombosis, and pulmonary embolism in diverticulitis. So first I'll be going over hyper and hypothyroidism, which affects the endocrine system. So what is thyroidism? The thyroid gland produces two hormones, T3 and T4. In hypothyroidism, the thyroid gland doesn't produce enough T3 or T4. Most of the time, it's a lack of T4 and raised levels of the thyroid stimulating hormone, which stimulates the production of T3 and T4. Hyperthyroidism, on the other hand, is elevated levels of T4. So for symptoms for people with hypothyroidism, they normally have an enlarged thyroid, slowed heart rate, irregular menstruation, pain in joints, muscle aches, higher cholesterol levels, weight gain, fatigue, constipation, sensitivity to cold, and dry skin. For those with hyperthyroidism, they have weight loss, tachycardia, arrhythmia, palpitations, irregular menstruation, increased sweating, tremors, irritability, sensitivity to heat, frequent bowel movement, swelling at base of neck, which is an enlarged thyroid, thinning of skin, fatigue, muscle pain, and sleeplessness. For those with hypothyroidism, this is mostly caused by an autoimmune disease in which antibodies attack the thyroid gland. It could be a side effect of medications. It could be caused by radiation therapy, which a lot of cancer patients go through. If a person gets surgery on their thyroid done and they get their thyroid removed, this could also cause the lack of T3 and T4. Pregnancy, pituitary disease, iodine deficiency could all be causes of hypothyroidism. On the other hand, for hyperthyroidism, thyroiditis, which is the inflammation of the thyroid gland, could cause an excess secretion of hormones. Graves' disease, which is an autoimmune disorder which causes the overproduction of T4, and malfunctioning of thyroid nodules could cause hyperthyroidism. Hypothyroidism. If a patient is facing fatigue, dry skin, weight gain, and constipation, a doctor will conduct a blood test or a TSH screening test. For hyperthyroidism, physical examination and a blood test are done, and if the blood test suggests hyperthyroidism, a thyroid ultrasound, a thyroid scan, or a radioiodine uptake test can also be done. For treatment, for hypothyroidism, synthetic thyroid hormones can be used. Pills like Synthroid and levothyroxine can also be used, with differing dosage based on the patient and how their body's doing. For hyperthyroidism, a radioactive iodine, which is an oral medication, can be used. Anti-thyroid medications and beta blockers can also be used. And a thyroidectomy could be done to just take out the gland itself. Hypothyroidism can cause the lifelong usage of medication. If not treated, this can cause death. For hyperthyroidism, this can lead to heart problems, but treatment is usually needed for it. There is a slim chance of getting by without getting treatment. However, it's recommended to get treatment. Thyroidism cannot be prevented. It's mostly a genetic issue and it can only be treated but not prevented. Next, I'll be going over deep vein thrombosis and pulmonary embolism, which affect the cardiovascular system. So what is deep vein thrombosis? It's a blood clot that occurs in a deep vein. Mostly it's found in the leg. What is a pulmonary embolism? So these are blood clots in the arteries located in the lung. For symptoms, DVT causes swelling and pain in the affected area, usually in the leg. It causes discoloration in the area and also warmth. However, this can lead to a pulmonary embolism, and I'll show you how in a couple of slides. Pulmonary embolism can cause shortness of breath, coughing, and chest pain. So when a blood clot breaks off from the leg or wherever a DVT is located, it can travel up a vein to lungs, and in the lungs it can clog the blood vessels, and that's what causes a pulmonary embolism. Anything that can cause blood clotting or disrupts the blood flow can cause a DVT. And blood clotting in the lungs, or whenever a person has a DVT and the blood clot travels up the veins and clogs arteries in the lungs that can therefore cause a pulmonary embolism. For DVT, if symptoms are shown, doctors will conduct tests. First, a physical, and afterwards, one or all of these following tests can be done: a D-dimer blood test, a duplex ultrasound venography, and or MRI scan can be done. For pulmonary embolism, after examining medical history and doing a physical test, the following tests can be done: a blood test, a chest x-ray, an ultrasound, CT pulmonary angiography, VQ scan, and pulmonary angiogram and or MRI can be done. On the right, on the top right corner, you can see a MRI scan of a DVT located in the leg. And on the bottom right corner, you can see a MRI done for pulmonary embolism of the chest. For DVTs, blood thinners, clot busters, filters, and compression stockings can be used to treat the clot. Mostly all of these are just to stop a clot from forming or break the clot down. For pulmonary embolism, for medication, blood thinners can be used and clot dissolvers can be used. Blood thinners might have to be used on a longer term in order to prevent more blood clots to be formed and prevent strokes. For surgical removals, you could do a clot removal or a vein filter for pulmonary embolism. Those diagnosed with DVT can be completely healed, but they might have to use blood thinners for the rest of their lives. For pulmonary embolism, this can cause death if not treated, and it is possible to make a full recovery with no complications. However, some did face swelling or discoloration of the area or pain in the area after getting treatment and getting over that clot, but this is not usually life-threatening. For both problems, exercise and refraining from sitting down for long periods of time can prevent blood clotting, and try to get your blood flowing, drink lots of water, and while traveling, wearing loose clothing and could really prevent the formation of a blood clot. Some medications could cause blood clotting, like birth control, so checking for any side effects could also help. Diet and exercise is really important, especially for those diagnosed with disorders like diabetes, and these can all be used to prevent both deep vein thrombosis and pulmonary embolism. Next, I'll be going over diverticulitis, which affects the digestive system. So what is diverticulitis? It's the inflation of diverticula in the digestive tract, which is located mostly in the large colon, which creates pouches in the area. This causes a lot of pain. Symptoms could be pain in either side of the abdomen, nausea, vomiting, constipation or diarrhea, or fever. A fatty diet that's very low in fiber can cause diverticulitis. It could also be a huge part caused by genetics. A lack of exercise, old age, and smoking can also be causes of diverticulitis. If a patient is showing signs, especially abdominal pain, a doctor will conduct a physical, and in this physical, they will check for abdominal tenderness. And then the following tests can be performed: blood urine tests, liver enzyme tests, stool test, and or CT scan. And on the right, you can see a CT scan for diverticulitis. For uncomplicated diverticulitis, antibiotics and liquid diet usually treats the disorder. For complicated, an intravenous antibiotics could be used, and a tube can be inserted to drain abdominal abscess. And for surgery, there's two types. There's primary bowel resection or bowel resection with colostomy. For those diagnosed with uncomplicated diverticulitis, treatment usually works and they can go back to normal. And complications don't really arise for both uncomplicated and complicated diverticulitis, but the disease can stay along for quite a bit and cause a lot of discomfort and pain. Eating a balanced diet that's high in fiber and less in fat could really work to prevent against this disorder. Drinking lots of water and avoiding processed foods can also help. Working out frequently and just having a balanced diet, drinking lots of water in order to ensure that you have a stable, consistent stool can also really help with prevention. And these are my sources. Thank you for taking your time for watching my video.